My name's Nevaeh. I'm here with Dr. Rob Koontz from Conley and Koontz Equine Hospital, and today we're going to be talking about foaling emergencies in dystocia, what every horse owner should know about them. Dr. Koontz, why is it important for horse owners to understand foaling emergencies?
Foaling is an exciting time, and people look forward to it, and people work hard to get there. But it can also be a scary time because foaling emergencies can happen quickly. Knowing the difference between what is normal and what is an emergency can be the difference between life and death for the new foal and for the mare. So at Conley and Koontz, we want owners to know what to look for, to know what is an emergency, when they should call, and when they need veterinary intervention.
Dr. Koontz, what is dystocia in horses?
Dystocia is a term that means difficult birth. And it's in horses, unlike other species, it is always an emergency because horses birthing takes place very, very quickly, within about 20 minutes. And if it's an explosive, fast process, and if it doesn't occur correctly, you can very quickly lose the mare and the foal.
What are signs of dystocia in horses?
So, as we talked about, birth in horses takes place very quickly. So if the mare is having strong contractions and you're seeing no progression, the foal is not coming out, after 10 to 15 minutes, that's a strong sign of dystocia. With every contraction, the baby should come out just a little bit further. Then the uterus will relax, and when the uterus relaxes, the baby will slide in just a little bit, and then the mare will have another contraction and push the baby out a little bit further. And that process happens in and out, but the baby should come back a little bit further. If your mare is having contraction after contraction after contraction, and the baby's not making any progress, the baby's not coming out, then she's having dystocia. Some other things to look for is the baby should be positioned with both feet coming out first and then the head on top of the feet. So if you only see one foot, or you see a head without feet, or you see the tail coming first, those situations would be a dystocia. Sometimes a mare will get exhausted, and if she gets too tired to continue to have contractions and she's just laying there because she's exhausted, that's a sign of dystocia. Or any other malposition of the baby is a sign of dystocia. If you see anything like those symptoms, you need to call right away.
In the event of a dystocia, will I have to transport my mare to a hospital?
Yes, it is very likely that if your mare is experiencing dystocia, that you will have to transport to the hospital. You should be prepared for that. So if you don't have your own truck and trailer, you need to have transport arranged before she gives birth. If you do have your own truck and trailer, you should have that truck and trailer hooked up, ready to go before the mare starts to give birth. You should also have any obstacles cleared for the truck and trailer because time is of the essence. So any snow, any other obstacles should be out of the way so that you can load the mare up and quickly get to the hospital. If you have dystocia, what you want to do is you want to call Conley and Koontz immediately, load up the mare, and we'll have our dystocia team waiting at the hospital for you.
In the event of a dystocia, will my mare definitely need surgery?
No, in the event of a dystocia, your mare will not definitely need surgery. At Conley and Koontz, what we do is first attempt what we call controlled vaginal delivery. And how that works is we put the mare under anesthesia. And so when she's under anesthesia, we then pick up her back legs with a very powerful crane. And that allows everything to tip forward. It gives us a lot more room to work and manipulate the foal so that we can deliver the foal vaginally.
If controlled vaginal delivery does not resolve the dystocia, will surgery be necessary?
Yes, unfortunately, if controlled vaginal delivery, if we are not able to resolve the dystocia using controlled vaginal delivery, then we proceed immediately to a C-section. Like everything else with the dystocia, time is of the essence. So if we cannot get the foal delivered vaginally, we will immediately go to C-section.
What is a retained placenta in a mare?
The placenta is the tissue that wraps around the foal when it's in uterus and when it's developing. And then once the foal is born and comes out of the mare, then the placenta needs to come out of the mare as well. If the placenta does not come out of the mare, that's what we call a retained placenta. And it is an emergency because The placenta staying in the uterus of a mare can cause some serious systemic illness and laminitis.
Dr. Koontz, how long should it take for my mare to pass the placenta?
The 1-2-3 rule applies here. So after birth, the baby should be standing within 1 hour. It should be nursing within 2 hours, and the placenta should be passed within 3 hours. If the placenta, so the answer to your question is 3 hours. If the placenta has not passed within 3 hours, you should call Conley and Koontz immediately.
How long should it take for a foal to stand after birth?
So again, the 1-2-3 rule applies. After birth, the foal should be standing within about an hour. So a normal foal is going to start to attempt to stand within about 30 minutes and should be standing within about an hour. Now it's going to be a little shaky. It's not going to be the best at it yet, but it should be standing within about an hour. Some breeds, some larger breeds like draft horses or racing standard breds, that's going to take a little bit longer than that. So if you have one of those breeds, do expect it to take a little bit longer than that.
How long should it take for a foal to nurse after they are born?
Number 2 of the 1-2-3 rule applies here. So it should take about 2 hours after birth for the foal to be standing and nursing. It's very, very important that the foal stands and nurses early because they need to get the colostrum, that's that first milk, and they need to get the antibodies from that first milk. If they're not standing and nursing within about 2 hours, it is an emergency, the foal's in some trouble, and you need to call Conley and Koontz Equine Hospital. Some of the larger breeds will take longer than 2 hours to nurse, and because they take a little bit longer to stand. If you do have a larger breed like a draft horse or a racing standardbred, be prepared for that and be prepared to milk out the mare, put the milk in a bottle and nurse the mare and let it suckle from a bottle while it has not stood yet in the sternal position.
How long should it take for a foal to pass manure?
So of the 1-2-3 rule, it should take about 3 hours for the foal to pass the meconium or the first manure. Now honestly, signs of meconial impaction is more important than a strict timeline. So if the baby is flagging its tail, if it's kicking at its side, if it's having abdominal discomfort, signs of colic, then that's a sign that it has an impaction and intervention is needed. If the baby's not showing signs, you can go a little bit longer than 3 hours, but a good general rule of thumb is about 3 hours.
Dr. Koontz, when should I call Conley and Koontz Equine Hospital during foaling?
If active labor takes more than 20 minutes, if the foal does not stand within 1 hour, if the foal is not nursing within 2 hours, if the placenta has not passed within 3 hours, if the foal is showing signs of abdominal discomfort, or simply something doesn't look right to you, you should definitely call. Foaling problems are an emergency. And if you have an emergency, you need to call right away to prevent possible death of the foal or the mare.
Dr. Koontz, what's the most important takeaway for horse owners during foaling season?
Foaling happens fast, and emergencies can happen even faster. A fast response matters. Be prepared. Be prepared to bring your mare and foal into the hospital if necessary. If you see a problem, know who you're going to call and call right away. Don't wait. Foaling emergencies are a critical problem that need to be dealt with quickly.